Welcome to another deep dive. We got some really interesting stuff to cover today.
Yeah, should be fun.
You guys sent in material on urological trauma.
Oh, wow.
So we're talking about kidney injuries and bladder problems,
Okay.
even penile fracture.
Interesting.
We're going to handle it all with sensitivity, of
Of
course.
course.
But get ready for some eye-opening medical insights
For sure.
as we take a deep dive into this world.
Sounds good.
Our goal today is to understand these injuries. What causes them?
Right.
How are they diagnosed?
Yeah.
And what are the treatments available?
It's a good place to start. These injuries might sound dramatic, but genitourinary trauma is more common than people think.
Really?
Yeah, it shows up in something like 10 to 20% of folks with multiple injuries.
Wow, that's a surprisingly high number. So where do we even begin with all this?
Well, let's focus on the kidneys first.
Wha-
Renal injuries account for 1 to 5% of all genitourinary trauma cases.
So that's still a pretty significant portion. Makes you wonder why they're so vulnerable.
Well, think about their location,
Yeah.
tucked away in the back of the abdomen, kind of exposed.
Yeah.
And men,
Yeah.
men tend to experience these injuries 3 times more often than women.
Interesting. So is that like an anatomical thing, or do you think lifestyle choices play a role?
Probably a bit of both.
Yeah.
Men might just be more prone to high-risk activities,
Yeah.
but the research on that's kind of ongoing.
Okay.
But the good news is most kidney injuries can be managed without surgery.
Okay, that's reassuring.
So,
And what about people with, like, pre-existing conditions?
oh, absolutely.
Yeah.
Any underlying issues like kidney stones or
Mhm.
hydronephrosis can complicate even minor injuries.
I see. So what are the main causes of kidney injuries?
Well, blunt force trauma is a big one.
Okay.
So folk falls or car accidents.
Yeah.
And then there's penetrating trauma, like stab wounds, for example. Each presents its own, challenges.
Okay.
But the interesting thing is, the way the injury happens actually helps doctors figure out how serious it is and what potential complications there might be.
It's almost like a detective story then, right?
Kinda, yeah.
Piecing it together based on the injury itself.
Exactly.
So what should we watch out for? What symptoms could indicate a kidney injury?
Some common signs include bruising around the flanks or lower back,
Yeah.
abdominal tenderness, and, blood in the urine. That's called hematuria, medically speaking.
Right. But the material you sent me mentioned that sometimes hematuria isn't present,
Yeah,
even when there is a kidney injury,
that's right.
which seems kind of counterintuitive.
It does, and it shows how important a proper diagnosis really is.
Yeah, for sure. So it's not always a clear-cut situation.
Nope.
So how are these injuries actually diagnosed?
Typically, doctors would start with an ultrasound. It's quick and easy,
Mm-hmm.
but it doesn't always give you the full story, though.
What do you mean?
Well, it can be tough to determine the depth of the injury or
Right.
to see if there are any urine leaks.
I see. So what's the best way to diagnose a kidney injury then?
The gold standard is a contrast-enhanced CT scan.
Okay.
Think of it this way.
Okay.
A regular X-ray is like a 2D snapshot,
Yeah.
whereas a CT scan is like a 3D movie of your insides.
Oh, okay.
It really lets the doctors see the location
Mhm.
and how bad the damage is.
That's a great analogy. But even with a CT scan,
Yeah,
I imagine it's still pretty complicated to actually interpret the results, right?
absolutely. So doctors use the AAST classification system to categorize it.
Mhm.
It ranges from grade 1 to grade 5.
Okay.
Grade 5 being the most severe.
So how does that grading system help doctors decide on a treatment?
It helps them figure out how much intervention is needed.
Okay.
So for less severe injuries, like
Yeah.
grade 1, 2, and even most grade 3 injuries,
Mhm.
a conservative approach is usually enough.
What does that involve?
Things like making sure the patient is properly hydrated,
Okay.
monitoring blood pressure, urine output,
Mm-hmm.
and giving antibiotics to prevent infection.
Right.
It's really about helping the body heal naturally.
So just giving the body the best possible environment to recover.
Exactly.
But when do you need to be a bit more hands-on?
Well, for severe cases, like those with a lot of bleeding
Mm-hmm.
or extensive damage to the kidney,
Right.
then surgery becomes necessary.
Okay. And what would be the goal of surgery in those situations?
The main goals are to stop the bleeding, of course,
Right.
repair any damage, and remove any tissue that's beyond repair.
Okay.
Sometimes the damage is so bad that removing the entire kidney is the only option.
I can imagine that's a tough call.
It definitely is, but the patient's life is always the priority in these situations.
Right.
Thankfully, advancements in surgical techniques are making it possible to actually preserve kidney function in a lot of cases.
That's good. You also mentioned something earlier called angioembolization.
Oh, yeah.
Can you remind me how that works?
Sure. It's a really cool procedure.
Yeah.
Allows us to target bleeding vessels directly.
Oh, wait.
So basically, a catheter's inserted into an artery in the groin and guided to the bleeding site in the kidney
Oh, wow.
using X-ray imaging.
So it's almost like a guided missile
Exactly.
going straight to the source of the problem.
That's a great way to put it.
And you said those particles they use can be permanent or absorbable.
Yeah, that depends on the injury, really. Sometimes you need a permanent fix. Other times, a temporary block is enough to let the vessel heal on its own.
Oh, okay.
It's a really interesting area of interventional radiology.
Cool. So moving away from the kidneys now,
Yeah.
what about injuries to the ureters?
Okay.
From the material you shared, these seem particularly tricky.
They can be. Ureteral injuries, so that's the tubes connecting the kidneys to the bladder. Right.
Make up only about 1% of these cases.
Okay.
But here's the thing.
Yeah.
They often go unnoticed at first.
Why is that? Are the symptoms not very clear?
Exactly. There isn't one specific symptom that points to a ureteral injury. Even blood in the urine, which you might expect, is only there in about half the cases.
Oh, wow.
So early diagnosis can be difficult.
And to add to that, the notes you provided mention that 75% of these injuries actually happen during medical procedures.
It's true.
Wow.
It's a reminder that complications can occur even during routine procedures.
Absolutely. What are the consequences, then, if a ureteral injury is missed?
Well, delayed diagnosis can lead to some serious complications.
Like what?
Things like sepsis, which is a life-threatening response to infection, or even urinary fistulas.
And what are those?
Those are abnormal connections that form between the urinary tract and other organs.
That sounds pretty serious. So how do you catch these injuries if they're so tricky to diagnose? Imaging is crucial, like intravenous urography or IVU and CT scans.
Okay.
Often a delayed film, one taken 30 minutes after the initial scan, can reveal a contrast leak and confirm the diagnosis.
So you have to look for subtle clues, kind of like a hidden picture puzzle.
Yeah, kind of.
Now let's move on to bladder injuries.
All right.
This seems especially relevant based on the material you provided.
You're right. The gold standard there is a retrograde cystogram.
Okay. And what is that?
So they insert a catheter,
Right.
fill the bladder with a contrast material,
Okay.
and take X-rays.
Okay.
This allows them to see any leaks or tears.
So moving on to urethral injuries now. Yeah. This seems like another area where anatomy is a key factor.
Definitely. So urethral injuries are classified by location.
Okay.
Anterior urethral injuries involve the part running through the penis,
Oh.
while posterior injuries affect the section closer to the bladder.
I see. There was something interesting I noticed in your files. It said,
Yeah.
in females, urethral injuries are very rare and almost always happen due to medical procedures.
Why is that? Well, the female urethra is much shorter and more mobile than the male urethra, so it's less vulnerable to trauma.
Interesting. What about signs of a urethral injury in men?
Blood at the urethral opening is a big red flag.
Okay.
And doctors also use a special X-ray called a retrograde urethrogram to actually visualize the injury and guide treatment.
Okay. So, last but not least, penile fracture.
All right.
I gotta admit, just the name sounds pretty alarming.
It definitely grabs your attention, doesn't it? But don't worry, it's not a broken bone. Penile fracture is actually a rupture of the tunica albuginea.
Okay, and remind me what that is.
It's the tough, fibrous tissue that surrounds the erectile chambers of the penis.
Okay.
Kind of like a protective casing.
I see. So what causes this rupture, and what are the signs?
It usually happens from a forceful bend of the erect penis, often during intercourse. You can imagine that protective casing suddenly giving way. You might hear a cracking sound, followed by a rapid loss of erection, severe pain, and swelling.
That does not sound pleasant.
Yeah.
What about visually? Does it look bad?
Well, there's a reason it's sometimes called eggplant deformity.
Okay, I think I get the picture. Sounds like you definitely want to get immediate medical attention for that.
Absolutely. Prompt surgical repair is really important to prevent long-term complications.
And what kind of complications are we talking about?
Things like curvature of the penis, painful erections, even erectile dysfunction can occur.
Wow. So time is of the essence with this type of injury. If you think you might have a penile fracture, what should you do?
Go straight to the ER. Don't wait.
Yeah, sooner the better.
Exactly. The sooner we can assess and treat the injury, the better the chances of a good outcome.
Okay, this has been a really fascinating look at urological trauma so far.
Yeah.
A little bit cringeworthy at times,
A little bit.
but definitely informative.
It's good to be informed.
Now that we've explored the causes, the symptoms, and the diagnosis, what's next?
Well, next we can dive into the specifics of treatment for all these various injuries.
Okay, sounds good. We'll be right back.
All right, we're back and ready to continue exploring these urological traumas. We talked about the causes, the symptoms, and even that sometimes stressful process of getting diagnosed.
Right.
But now let's shift gears and talk about the treatments that are available for all these different injuries.
It's a good next step because, understanding your treatment options can be really empowering.
Yeah, absolutely. You mentioned earlier that a conservative approach is usually the way to go for those less severe kidney injuries.
Right.
What does that actually look like in practice?
Well, for those grade 1, 2, and most of those grade 3 injuries, stabilizing the patient is the top priority. We want to make sure they're properly hydrated, monitor their blood pressure and urine output.
Yeah.
And of course, we use antibiotics to prevent infections. It's all about giving the body the best chance to heal itself naturally.
So it's like setting up the perfect environment for recovery.
But what about situations where you need to be a bit more, hands-on?
In severe cases, those with a lot of bleeding or significant kidney damage, surgery becomes necessary.
And what's the goal of surgery in those cases?
Well, the main goals are to stop the bleeding, first and foremost. Repair any damage to the kidney. And remove any tissue that's just too damaged to save. There are cases where the damage is just so extensive that removing the whole kidney is the only option.
I bet that's a really difficult decision to make.
It is. It really is. But in these situations, the patient's life always takes precedence.
Of course.
Thankfully, there have been some amazing advancements in surgical techniques. And we're now able to preserve kidney function in many cases.
That's good news. Now, you mentioned a minimally invasive technique earlier, angioembolization.
Right?
Could you remind me how that works again?
Of course. It's a pretty remarkable procedure that lets us target the bleeding vessels directly. Picture this. A catheter is inserted into an artery in the groin. And then using real-time X-ray imaging, it's guided to the bleeding site within the kidney.
Oh, wow.
Yeah, it's pretty cool.
So it's kind of like a guided missile zeroing in on the problem.
You got it. Once the catheter reaches that bleeding vessel, we inject these tiny particles through it to block the blood flow. It's like plugging the leak.
And you mentioned those particles, they can be permanent or absorbable, right?
Yeah, that's right. The choice depends on the specifics of the injury. Sometimes you need that permanent fix. Other times, a temporary block is all you need to allow the vessel to heal naturally. It's a really fascinating area of interventional radiology.
That is really cool. So let's switch gears now and talk about treatment for ureteral injuries. These seem particularly challenging given their location and all the potential complications.
They certainly can be tricky. The approach depends on the extent of the damage, really, and the overall health of the patient. For small tears or leaks, sometimes a ureteral stent is all that's needed.
What's a ureteral stent?
It's a thin tube, very flexible, inserted into the ureter to keep it open and allow the urine to drain properly. You can think of it like an internal split that helps the ureter heal.
And for those more severe ureteral injuries, where a stent might not be enough.
Well, in those cases, surgery often becomes necessary. The surgeon might try to repair the ureter directly. But if that's not possible, there are other options. Sometimes they can connect the ureter to a different part of the kidney. Or even use a piece of the intestine to bridge the gap.
Wow, that sounds like some really delicate and complex surgery.
It is, no doubt about it. It requires specialized expertise, and meticulous technique. But thankfully, the success rates are encouraging.
Okay, good. Let's move on to bladder injuries now.
All right.
What's the usual approach to treating those?
Well, similar to those ureteral injuries, the approach really depends on the type of rupture, and how bad it is. So for extraperitoneal ruptures, that means the tear doesn't involve the abdominal cavity.
Okay.
Often, just draining the bladder with a catheter is enough to allow it to heal.
So no surgery required in those cases?
Most of the time, no.
Yeah.
But sometimes, if the tear involves the bladder neck, or if there are any bone fragments stuck in the bladder wall, surgery might be needed to take care of those complications.
Got it.
Now, intraperitoneal ruptures, on the other hand, those are tears extending into the abdominal cavity. Those almost always require surgical repair.
Why is that?
Well, when urine leaks into the abdomen, it can lead to serious infections. Surgery helps to minimize that risk.
Makes sense. So what about those urethral injuries? What are the treatment options for those?
For minor urethral injuries, we sometimes use what's called a suprapubic catheter.
And what is that?
It's a catheter that drains the urine directly from the bladder through a small incision in the abdominal wall. It bypasses the urethra completely, allowing it to heal without the irritation of urine flowing through it.
That's pretty clever. But I'm guessing more serious urethral injuries need a different strategy.
Absolutely. For those complete tears or injuries with a lot of tissue damage, you need surgical repair.
And what's the goal of the surgery?
The goal is to restore the continuity of the urethra and minimize the risk of complications like strictures.
Strictures, remind me what those are.
A stricture is basically a narrowing of the urethra, often caused by scar tissue. It can make urination difficult and painful.
Yeah, that doesn't sound good.
No, it's not fun.
So we've covered a lot of ground here. Kidneys, ureters, bladder, urethra.
Yeah, we have.
Anything else we should discuss in terms of treatment?
We should probably circle back to that penile fracture.
Oh, all right.
We talked about the causes, the symptoms, and the need to get medical attention quickly. But it's worth really emphasizing just how important that prompt surgical repair is.
I agree. Nobody wants to delay treatment for that one.
Nope, definitely not.
So delayed treatment, it increases the risk of long-term problems.
Yeah, things like permanent penile curvature, painful erections, even erectile dysfunction.
Wow, okay. It's clear that time is of the essence with these injuries. If someone thinks they might have a penile fracture, what should they do?
Go to the emergency room immediately. Seriously, don't wait. The sooner we can assess the injury and get things moving with treatment, the better the outcome is likely to be.
This has been a really great overview of the different treatment options for these urological traumas.
Yeah, it's been good.
But what happens after treatment? Are there any long-term effects that people should be aware of?
That's a great question. It's definitely something to think about. You know, even though prompt treatment is crucial for minimizing complications, it's important to recognize that some folks might experience lingering issues.
So even with successful treatment, there can still be lasting effects.
Unfortunately, yes. Let's talk about those potential long-term consequences.
Okay, we're back. We've covered a lot of ground talking about the various treatments for urological trauma, but now it's time to talk about something we haven't addressed yet. The potential long-term effects of these injuries. I mean, it's one thing to treat the initial injury, but what about the lasting impact they can have?
Yeah, it's a really important topic. You know, while prompt and effective treatment's key to minimizing complications, it's essential to recognize that some people might have issues that linger even after the initial injury has healed.
So even with the best treatment, there could be kind of a shadow of the trauma left behind.
Unfortunately, yeah, sometimes. For instance, someone who's had a severe kidney injury, they might face a higher risk of high blood pressure or even kidney failure down the road.
That's concerning. What about bladder injuries? What are some of the potential long-term effects there?
Well, bladder injuries can sometimes lead to problems with bladder control, you know, like urinary incontinence or having trouble fully emptying the bladder. Scar tissue can also form and restrict the bladder's capacity, which can lead to more frequent urination or that constant feeling of urgency.
So it sounds like the bladder's ability to function properly can really take a hit.
Exactly. And when it comes to urethral injuries, strictures are a big concern.
Okay, strictures. Can you remind me what those are again?
Sure. A urethral stricture is basically a narrowing of the urethra, often caused by scar tissue. This can make it difficult and painful to urinate.
Yeah, I imagine so.
And sometimes it requires ongoing treatment to manage.
So we've talked a lot about the physical impacts of these injuries, but I'm guessing there's a psychological component too, right?
You're absolutely right. The emotional and psychological effects can be really significant. It's important to address those aspects of healing as well. You know, trauma, regardless of where it happens, can leave those mental scars.
Absolutely.
Yeah.
It's a good reminder that True healing involves the whole person, not just the physical injury.
Hmm.
So what's being done to help folks cope with the long-term consequences of these urological traumas? Is there any promising research on the horizon?
There's a lot of great research going on focusing on improving treatments and long-term outcomes.
Okay.
Scientists are exploring new surgical techniques,
Mhm.
regenerative medicine approaches,
Oh,
even preventative strategies. It's a really exciting time for advancements in this field.
that's really good to hear. So, given the range of complications that we've talked about, what steps can we take to prevent these types of injuries from happening in the first place?
Well, prevention is key, right? Simple things like wearing your seatbelt, using proper safety equipment when you're playing sports, and being mindful of risky behaviors can go a long way in reducing the risk of these traumatic injuries.
This deep dive into urological trauma has been really insightful,
It has.
maybe a little cringy at times,
I know, right? Some of it's hard to hear.
but definitely informative. So, any final thoughts for our listeners as they learn more about this?
I think knowledge is power, you know?
Yeah.
The more we understand about these conditions, the
Yeah.
better we can advocate for our own health and make informed decisions. Don't be afraid to ask questions and get reliable information.
That's great advice. And remember, if you ever think you might have a urological injury, don't wait. Seek medical attention right away. Prompt treatment is so important.
Well, this has been The Deep Dive. We'll see you next time.